Hi, good evening, everyone.
Good evening, this is Mina.
Hi, hi,
Hi.
Carla. How are you?
I'm good.
I'm just hoping one thing that I am hoping as we start a new slip before we officially start, that all those who are in the position to turn on the cameras, I don't like speaking to a dark screen. I like to see faces as well as I hear the voices. I like to see faces as well. So I'm just asking if persons can turn on their cameras. It's now 7:01. So I usually give a grace period for persons who are coming in. So we could start just like 7:05 because persons are coming home. So in the meantime, we could chit chat, we can talk, and it's good to see you. We have some new faces. I see Cecilia. Cecilia is in transit. She's still driving. Hi,
Yeah,
Cecilia.
but my daughter has swimming on Thursday, so I was like, I'm gonna do this from the car. So I'll turn off my camera when I'm like going from the car to the
No,
apartment, and then I'll turn it back on. But I'll
yes,
be
yes,
listening.
no problem at all. So
Thank
then we
you.
have is Kayla, right? Yeah,
Oh, Kayla, yes.
it's Kayla. Okay, so we have Kayla, and then we have his is Hillary Helus. Can you pronounce it, please?
Yeah, it's Eloise.
Oh,
yeah.
Heloise. Oh, so you spell it. Okay, so it's spelled differently. Okay. Wow.
Nice to meet
So
you all.
same here. It's nice to meet
Same.
each and every one of you. It's
Good evening, everyone.
and then we have our beautiful um district assistant district manager Mia, who keeps the ball rolling and keep us in check. So she's with us. Can you imagine? Can you imagine we're in September? Can you imagine it is September? Wow.
Yeah.
I
The
don't know.
summer flew by. Definitely
Yeah,
did.
yeah, summer definitely flew by. So whilst we are waiting, we have 2 minutes to go, and then we will just have 2 minutes. 2 minutes. I just want to say welcome to each and every one of you. I have been looking forward. Oh yes, I do miss the meetings. In spite of the fact that I enjoyed the time off, I missed the meetings. And then we have Mr. Milford, who is joining us as well. So I just want to say welcome to each and every one of you. And for our icebreaker, before everyone go around and to introduce themselves and just in just like a minute or so, with your introduction, where you are, where you're from, or whatever. My icebreaker question to you: we have a few days of this summer. We have Monday, Tuesday. After Labor Day, that's it. What are your plans? What are your plans for this long holiday weekend?
Well, I'm gonna go first only because I'm on the floor because I have Parkinson's and I fell and the emergency is coming to pick me up. But I'm uninjured. I'm not in pain. So I was able to grab my laptop and fall with my laptop because I didn't want to miss this meeting. So that's why my camera is so dark. But I just wanted to learn about CB9 this summer, what remains of it. So that's my story. I hope you understood what I just said.
Yes, Mr. Pewitt. Thank you for logging in, and I hope you are okay.
Okay, thank you. Somebody speaking in their mute.
Oh yes, I am muted. I was saying I'm so sorry and hope that you feel better. So I'm assuming that you will be signing off soon. You wouldn't be staying on with us.
No, I am signing in. I mean, I consider myself signed in. I have to wait 40 minutes or so for the emergency services to get me off the floor. So so they're en route, I imagine.
Okay, see, that's exactly what I'm saying. I'm like, when they
Mm.
get there, I'm assuming that you will be signing off.
I will be, no, why should
You
I?
stay on? Okay, all right.
All right.
Okay, so, so my question again on the floor. What's your plan for this long weekend? I'm gonna start, if I have to wait for everyone, then I just gonna go around and I just go, Kayla, go ahead.
Hi. I don't have specific plans. I think I might spend it like with family, and things. It'll be the anniversary of my mom passing actually. So I think we might celebrate a little bit together.
Hmm,
So basically, so
Okay.
towards me.
Karima,
Mm. Hi, Fran. This weekend, I'm heading up to the Parkway.
oh, okay,
Yeah, I'm heading up to the Parkway, dancing up, winding up. You know.
that's her weekend, okay.
As you
Eloise.
should. As you should.
I have an exam Tuesday, so I'll be studying.
Hmm.
Fun stuff.
Cecilia,
On Saturday, my daughter's turning 2, so we're gonna be having a little like dinner, birthday party at the apartment. So that's it.
Okay.
Just, you know,
Yeah.
holla at the
And-
cam.
okay. Mina, is,
Um,
I'm pronouncing it good, right?
yes,
Mina?
Mina,
Okay.
Mina. The usual, it's marathon training season, so I'm hoping to do a run with Adidas Run Club. We're supposed to be running to the Rockaways, so that's Saturday. And then
Okay.
Sunday, probably more running.
Nice.
Okay. And we have Alexandra who joined us. I'm hoping that Alexandra we can see her face to see who she looks like. If I can see the face of persons who are on, that would be great. And Alexandra, the question on the floor is, with this long weekend, the ending of summer, what are your plans? You're muted, you're muted.
Hello, everyone. So yeah, it's my first time joining the meeting, and this weekend I'm going to be traveling out to Jersey to spend it with my family in Jersey.
Wonderful and welcome. We are just having an icebreaker, and as soon as we finish the icebreaker, we'll be introducing ourselves officially. And Mia.
Good evening, everyone. I guess I'm just trying to make the best of the last official weekend of the summer with my family. Despite it is going to be a traffic headache, but I guess finding something to do that doesn't involve a car.
Mm.
I agree with you. For me, I'm thinking of doing the 5S. Sleep, 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 sleep. That's what I'm looking forward to doing. I got a call from the commissioner, sent me an email today and asking for me to meet the mayor and the Parkway because the mayor wants someone from our office to represent them. So I'm like, I'm looking to sleep, but usually if I do go, I don't jump up or anything. I don't get involved in the reveling. I usually just get on the float, go with them. I just identify with them and I have lunch and head home. So I'm not certain as to how that will go yet. So as we start officially, it's now 7:10. I want to just welcome you again, officially welcome you. We are starting, this is September 1st. We had a summer. I'm hoping that each one of you had a good summer. I think Celia, no, it's not Celia, Kayla said, talk about the passing of her mom. And I'm sorry, but you were here, and I'm just hoping that as it's a process, it takes a long time.
Yes.
And you will just remember and just embrace the good memories. You know, when you miss her, just embrace the good memories. And don't listen to anybody who tell you, girl, don't cry. Cry when you want to cry. Scream
Yeah,
when you want to scream, you know?
yeah, grief
And
has no
just,
timeline.
yeah, so,
Yeah, if it's any consolation, Kayla, this past May is the anniversary 6 years since my mom died. And this was probably the first year I did not break down crying and in a ball of world of hurt. It will take time. You won't feel so great for maybe a couple years or however long, but it will take time, and there will be a day where you won't feel as thing, but
it gets
my
better as time
condolences.
goes. Yeah, it gets better. And this is, so since we are starting, I just want to let each one of you except Karima, Viola and you, and this platform is a platform where we are family. When you are here, you are family. We become a family. So if we have to cry together, we cry together, we laugh together. Whatever that you have to say, we are there for each other. So we may be in different places and different homes, but on this platform, consider us family on this platform. So now I will open the floor again, and then we'll start again with Kayla. Thank you, Kayla. Thank you, to officially introduce yourself. But before we start that, I would really I know the meeting is being recorded, so I'll just keep that and come back to it. So we'll start with Kayla for the official introduction of yourself, where you live, and just 1 minute of introduction, please. Kayla.
Okay, hi everyone. First, I want to say thank you guys very much for your words of Flora. That really meant a lot, and I really appreciate it. My name is Kayla. I live in Brooklyn. I'm in Flatbush, Maple and Flatbush. I just graduated from Stanford, so I was in Cali for a couple years, but I'm back. I'm very happy to be back. I studied political science and data science because I just wanted to learn more about I guess like how things I experienced growing up, like I guess like how it got to that, like what systems brought us there and what solutions we could be coming up with. So now I work on the side at a foundation, but my friends and I also do like nonprofit work. So like we work in schools doing mentorship, and we're trying to like just grow a network of people that are able to like invest more into our youth and our communities. So yeah, that's pretty much me, I think, in a nutshell. And my family's from Jamaica. Yeah.
Okay, thank you so much. So I'm moving over to Eloise.
Hi, my name is Eloise. I currently live in Long Island. Actually, I'm attending medical school, but I'm here on behalf of CAMBA, specifically trying to address the opioid epidemic. So was wondering if there were any events y'all think could use some Narcan training, Narcan distribution and Narcan training. I'm not sure when the appropriate time is to talk about that, but yeah.
Wonderful, so welcome.
Thank you.
Awesome.
Okay, so we're moving over to Cecilia.
Hi, I'm Cecilia. I live on Clarkson and well, between Nostrum and Rogers. So like I just made it by the skin of my teeth for the district. I just, you know, I'm a project manager is my real job, but I'm also a doula trainee. So I've done a couple of births. And I just really wanted to get involved in the community. I was transplant, well, not transplant, I grew up in Harlem, but my husband, I said he was driving, he lived in Brooklyn, and so I moved over here. Now I love it. So I'm really excited to be a part of this.
Okay, so welcome again. Welcome to the neighborhood.
Okay. Oh, and I also
Okay.
studied political science in college too, but that was like a long time. Hey, poli sci.
Okay, so I'm going to go to Karima.
Hi, everybody. Can y'all hear me?
Yes, loud and
Okay.
clear.
Okay, good, great. My name is Karima Griffin. I've been a member of CB9's Health and Social Services Committee for this, somewhere later this September will be almost 3 years.
Mhm.
And I studied public health at SUNY Downstate, as well as Brooklyn College, and health promotion health promotion. Yes, I did went to college like 3 different times. My interest is in health, in community health, particularly health promotion and community health, and overall helping the community to live a healthier, better life, however way I can.
All right, thank you, thank you. So we have Rihanna who just joined us. Welcome, welcome. So you missed the icebreaker, so can you introduce yourself, a 1-minute introduction to yourself and where you live to the group, please? Welcome. And are you a member of the group or you are here to present something, first of all?
So my name is Rihanna McKenzie. I live on Clarkson between
Okay.
Rogers and Bedford. I Guyanese, transplant from Guyana, been living here for about maybe 13 years.
Mhm.
I work for the Department of Health and Mental Hygiene. I also studied public health at SUNY Downstate, graduated in 2018. So I'm here on behalf of my community because I'm also have an interest in not only health, community health, but also in terms of community health, we're talking about all the social determinants of health, including our built environments. So a lot of my passion too goes to a lot of the racial equity work that I do at the department, along with contract managing especially for people with developmental disabilities. And outside of that, I am a part of the Rotary International. I'm the president for the Brooklyn Bridge Rotary Club, which is a service organization that does community work also. So we do work in hunger alleviation, maternal and child health. So I'm here on behalf of my community, but also I'm representing the Brooklyn Bridge Rotary Club.
Wonderful. So you are a community member. You are not a member of the board, but you are representing. Wonderful.
Yeah.
I'm just bubbling to hear all those introductions and all those persons as to what you're bringing to the table. So I'm going to call on Maina.
Hi, everyone. My name is Mina Lagute. I live in, I guess, Prospect Lefferts Gardens, between Nostrand and New York. I've been a member of the board for maybe 2.5 years. I was previously on the Parks, Recreation, and Culture Committee. This is my first year on this committee. Excuse me. I'm interested in health. In the community, I'm a member of the Prospect Park Track Club. I just joined them earlier this year. I've been an avid runner since 2015, I guess. My favorite pastime is, well, I don't say if it's favorite. I like to run. I'm a runner. Looking forward to running the Berlin Marathon later this month and then the New York Marathon in November. Birthday week.
Thank you so much. And calling on Cecilia.
I think her mic is still on.
Oh, Cecilia did introduce herself. Alexandra, Alexandra?
Hello again, everyone. So my
Hi.
name is Alexandra Cameron, and I'm in Prospect Heights, Brooklyn. That's on St. John's between Underhill and Washington. And I just happened to saw this community board meeting today and decided to log on to see what it's all about. So I'm just here to see what I could take away from it.
Wonderful. I pick up an accent. Where are you from?
I'm from Guyana originally.
You're from Guyana too? Okay.
Yes.
All right. I think Rihanna, so that's just from Guyana.
Yeah.
Yeah, wonderful. Okay, so Mr. Milford.
Yes, thanks for your patience. I'm a retired journalist. I was a food writer, and I'm the editor currently of the Prospect Lefferts Garden Echo. I've been putting out the Echo for the past 10 years. You may know Ben Edwards. He and I were very close, and he was the previous president of the Lefferts Manor Association, and he served as chairman of the ULURP committee for years. And I don't know if you know him, but he was my influence. And when he died suddenly, I felt it was time to, instead of writing about the neighborhood, do something about it. And so I'm on the Health and Social Services Committee, and I hope to use my language abilities and my interviewing skills to help the board proceed as far as it can. And I look forward to this endeavor and this challenge. Thanks a lot.
Thank you. And I don't think I missed anyone, but I'll call on Mia.
Good evening, everyone. My name is Mia Hilton. I am the Assistant District Manager at Community Board 9. I've been at CB9 since 2017. I'm a lifelong resident of the district. I am a parent of a student in the district. I'm excited for this meeting session and happy to see new faces and old faces, and excited about what lies ahead for the committee.
All right, thank you everyone. Last but not least, my name is Francisca Leopold. I'm the second vice chair on the board, as well as the chair for this committee. The very first time, how many years ago? Like 5 years, 6 years ago, when I was placed on this committee, I was so angry. I was like, I don't want to be chair for Health and Social Services. And I'm telling you, when I started and I started going around in the community and I saw the needs, I got so excited, and I don't want to go to another committee. I just love this committee, and I just love the energy that is brought here this evening, this platform, this one. We have had some great people who've joined us, and we had two years ago, we had a resource fair on Lefferts Avenue. I live on Lefferts Avenue. I'm sorry, I'm from Brooklyn. I live on Lefferts. We are not too far from each other. I live on Lefferts between Bedford and Rogers. So we are just thrown far away from each other. So we had a resource fair, our first resource fair, a wellness fair for the residents. And my passion is just to see the services. We have so many elderly people in our community, and then there's so much for them out there, and they are not receiving the services. I have been working with the senior centers, and what we have done is just a drop in the bucket, but with the knowledge and the energy and the passion I'm hearing here this evening, I'm looking forward to us coming together. And at the end of the day, I'm just here to talk, but I want us to put our heads down, sit and say, well, it's what Fran says because it's the chair. At the end of the day, this is our committee, and it is our community. And I want us to put our heads together. You see something, you want something done, you think that we should endeavor on this thing, take this rope, we will take it. We don't want a weak link, we want a strong link. So we all will be together and we will make this happen. I'm looking forward for us to have a really good year. We have the mental health issues in our community. We have the seniors issues in our community. We have the social aspect that's not been addressed at all in our community. We have HIV, which is pushed under the carpet in our community. We have so much more in our community that needs to be addressed. Outside of that, I work for the New York City Commission on Human Rights. I'm a trainer. I go and teach organizations and they teach the community as to what their rights are if they've been discriminated against. So I do training when it comes to discrimination. And I'm also the chair on the board at Kings County Hospital. So I'm all around the in the community, and I know we have persons that are affiliated with the with other health entities as well. So I'm really looking forward for us working together and really bring much services and energy to the people. I don't want us to sit, come on every Thursday, have a meeting, talk, discuss, and when we said good night, that is it. I want us to be active. I want us to do work, go out there, come back, and just hit the ground and get things going. So I see a hand. We have a hand up. Karima, you had something to say?
Yes, just briefly, and I get back to give the floor back to you. Yeah, sorry about that. I forgot to disclaimer that I live in Brooklyn, that I used to live in Crown Heights for 26 years. Since I was 4 years old, I used to live on Utica and Carroll on Eastern Parkway, but I currently live in Brownsville, like right on the border between East 98th Street and Rutland Road. Yeah, I just literally went like one zip code over. I'm currently in training. Kingsbrook and this other nonprofit organization, Health People, came together and start this new training program for diabetes self-management community peer educators. So I'm getting trained to do that and to teach folks who are diabetic and in between to how to manage their diabetes on their daily, regular, day-to-day life and stuff. And I know that would be super useful because last I checked, Crown Heights is one of them neighborhoods where diabetes is high, one of the concerns for our community. So there's that.
Well, thank you for that. And it is something that we've been talking about at the hospital, because one of the areas where issues that we have been discussing is the lack of healthy food in our community. And I noticed that even during the COVID, we went out there, we were giving out masks, we were giving out hand sanitizers, we were out there working, and Kamaya, we were out, Karima, we were out there working out there. But one thing that I noticed, even when we had the food pantry, Diana Richardson, right there next to the board office, she used to be out there giving out food, and there were other organizations. There was a church in Bedford and Lefferts, they give out food during the COVID. And I mean, it was the persons in the community, they were happy for the food that was coming. But we are looking at the food. We are not getting fruits coming to our community. We are not getting vegetables coming into our communities. And then when you leave and we go down to Coney Island, you go down to the other parts of the community, they just get the best fruits, the grapes and the berries and the
whole rainbow,
and everything. But in our community, when we look, when you find a stand, somebody put a stand outside with fruits, they're so expensive, you know. And so this is something that we have to look into, because our seniors, our young people, when you see a 5-year-old child walking down the street and already have a stomach, that's an issue, you know, because they're just being fed all the wrong stuff, you know. I was in the bus and I saw this little girl. She might have been maybe 9 years old, and she had a big thing, paper plate in her hand, you know, full with pork, you know, and she was shabby. Now, maybe that's what the parents could afford, but they have to be educated. Our people have to be educated. We have to educate them. We will sit on the side and we look and we complain and we criticize. But then if they're not educated and they don't have the means, whatever that they get to give the children, whatever they get to feed themselves, that's what they will do. So we have to get ourselves in that place. And as I will say again that I'm happy to have each one of you, because I know each one of you brings something different to the table where we could put it together and then we could work and to make things better in our community. I know that Hillary is there with us. I'm looking at the time.
Yes.
So we have really and truly, I want us to discuss. I know we are just meeting, but anyone who have any ideas as to what you might want us to, as she present, you just think, so we have two items as you look at the agenda, the planning for the quarter as to what we want done for the quarter. It could be just one thing that we undertake for the quarter, and also for our nursing homes and our shelters. They need help, and they need help. So I would like us to focus on the nursing homes and the shelters in the community. So, so as we listen, because as we listen to Heloise, if for any which other organization, it could be your job. And I know many of you are out there, and there are so many huge, I've attended so many resource fairs. I know there are so many different areas, and even Heloise, it will not be this month, as I restart the CABS, the review board, as we have our meeting. It is something next week I will be meeting with my team before we open officially. We have our first meeting, and it is something that I will really bring to them, so you can come to the hospital and make a presentation to the board as well. So just keep that under your belt, under your heart, that you will be coming to the hospital and to do a presentation on this. So and any one of you know of any organization that you think that it would be beneficial to them to have her to come. As she said, she's part of Combat. Combat is part of our community. They have been doing much in our community in all areas. And then so she can get and let her know, contact the board will contact her. And before you leave, I would like you to give us your information. So at least we have your information, and we'll be able to contact you if we find an organization in the community, because we really want our community to be well educated, and they will know their way of all the services that are there for them. So without any further ado, I'm going to give you 10 minutes to do your presentation, and go back to our meeting. The floor is yours, Heloise.
Okay. I don't think it'll take a full 10. It's not too long. But basically, as many of you know, we're in an opioid epidemic. Unfortunately, overdoses from opioid use is only increasing. It's hit about 100,000 a year, which is a new record high. And it's mainly, or a big reason this is happening, is because of the introduction of fentanyl, which is a very potent opioid. And it's increasingly found in not just opioid drugs, but also many street drugs, cocaine, Xanax, almost anything. So now it's not just opioid users who are in danger, but it's any drug user. So one thing that we can do to try and fight the overdose rate is use Narcan and train people on how to use Narcan. So what Narcan is really naloxone. It's an opioid receptor antagonist. So it basically reverses the effects of opioids. So if someone has taken too much opioids, you can give them Narcan. It's usually as a nasal spray, and it will replace the opioids in their receptors with naloxone. And that way it will basically allow them to breathe again, they'll wake up, and it will prevent them from overdosing. And one important thing to know is if you give it to someone who is not using opioids, it's not going to hurt them, it's not going to do anything to them. So it's okay if you think someone's overdosing and they're not actually on opioids, if you give it to them, you're not going to hurt them. So the more we can train people on how to use Narcan, the more lives we can save. Statistically, most overdoses actually happen in front of someone else. So even if you don't use opioids yourself, having Narcan could mean that you could save someone else's life. So basically, I started volunteering for CAMBA so I could increase Narcan distribution and training. So if you think there are any events that could benefit from that, we can bring free kits. So we'll bring the actual Narcan kits. We'll do a brief presentation and a training on how to use it. And then one other thing we might be able to do is also bring fentanyl test strips. And those aren't so useful for people who use opioids, because unfortunately almost all opioids have fentanyl in them now. But at least other drug users who don't use opioids, it might be useful for them to test their drugs to see if it has fentanyl in it. But yeah, that's basically why I'm here. And is now a good time for me to give my contact information?
Anyone, any questions for Heloise?
Yeah, I was curious, the training of the neighbors on how to use Narcan. You made reference to we would align ourselves with other associations like CAMBA. That strikes me as a very small, it strikes, I mean, to make it a widespread, teaching moment and where the people are trained into how to use the Narcan, it's a syringe, right? It's just a syringe.
The Narcan is actually a nasal spray, so it's very easy for anyone to use. You just spray it up someone's nose.
All right. Well, I would just it just seems to me that and this is like I said, that's why we're working it out on the first day is I just question. I'm just worried about how do we pass along this information on how to use it to the degree that it will be effective, as opposed to a micro section of the neighborhood. You know what I'm saying?
Yeah. Do you
So
mean?
if I may interject, that usually on the committees, that's what we have the committees for. The board has committees. And when someone has to do a presentation like this, they bring it to the committee. And if now I feel, well, okay, and we have the assistant district manager who is there now, and we said, okay, you know what, I can take this back to the executive when we meet. And I said, this person made this presentation, and I think this is something that we should bring to the board, the body to do a presentation, and they approve it. So when the board has the next meeting, they can put that on the agenda, and then she will present it to the entire board. They'll give her 5 minutes, and she didn't even take 5 minutes, and then she'll present it to the entire board. If she do have the canisters or whatever, because I'm assuming, correct me if I'm wrong, Mia, but September will be our day, we will be meeting on Zoom, but going forward, we might be meeting in person. So she can do a presentation online, and then when we are going out to the governor and the mayor as to how the state changes it, if we have to go out and have in-person meeting, then she could be there, and then she do the presentation and show persons how to use it. So usually, as it works as a small group, the persons make a presentation, and then based on the committee, and then the chair of the committee then will take it to the exec. Then the exec will approve it, and then give the information in a wider scope when the entire board meets, which most times we have 60, 70, how many persons. But as she says also, if you are engaged with a committee, a community, networking out there, whichever organization you are involved with, and you think that this information is good to present, you could let your organization know, here I have this person who can come, and do a presentation. So therefore they will invite persons to come. And then, if they have a meeting and she only take 3-4 minutes, and she'll just do her presentation, show how to use it, and it's done.
Yeah. Okay. One thing I want to say is the training will take a bit longer to be trained on how to use Narcan. That would probably take upwards of half an hour to 45 minutes.
Okay,
yeah.
Okay.
But in terms
the addiction to fentanyl and all that stuff it's a problem level in CB9. I mean, in other words, I mean, we have a significant problem in CB9 with that problem.
I know it's an issue in basically all the boroughs of Manhattan. The leading borough, it's the greatest issue is in the Bronx, but Brooklyn definitely has a high rate of
Mhm.
overdoses. But that's also why I'm here is, yeah, so I can engage more with the communities here and potentially train people here if you have any good ideas of which communities to reach. And one other thing I should mention is we can do the trainings over Zoom and then
Okay.
mail people the Narcan kits to make it more accessible to those who can't come in person.
Wonderful. Yeah, can you give us your information, please?
So my email is H as in Henry, M as in Mary, D as in David, 2126 at columbia.edu. And Columbia with a U.
Columbia.edu.
Mhm.
Okay, and your telephone number?
609 651 3145.
And you say that's HMD 2126 at columbia.edu.
Perfect, yeah.
Okay, anyone else have any questions, any comments for the presentation?
I have a quick question about like who your target audience is in terms of training. So is it like students, like maybe adults? Like, do you have like age ranges or anything?
Honestly, we want to reach as many people as possible. And fentanyl is increasingly affecting lower ages, so I don't even think middle school or high school is too young. But yeah.
Okay.
All right.
All right. So maybe we can target Mia. Maybe we can reach out to Megas Everest. I don't know if they have anyone. Oh, I thought, anyone over there who have done any training. And also we have the three schools over by Ebbetsville. I know persons in there, so I can reach out to them as well. And maybe you can do a presentation at the school.
Yeah, definitely. That sounds really great.
What was the phone number again?
609
Uh-huh.
651 3145.
3145. Okay, thank you very much.
I would think the police precinct would be a good source for pockets of addiction in the throughout the neighborhood.
Yeah, that's a good idea. So I can also talk to I'm the community liaison for the 70th precinct. So I can speak to community affairs and hear what is here. And even them too can get you can do a training with them as well. So when they do meet up with persons who has the issue, that they can be able to administer the doses on them. So that's a good idea.
And quick question, the 3 schools you mentioned, are those high schools, middle schools, or both?
Yeah, I think it's intermediate. Amir, do you know the difference in the schools?
The schools, the only school that has an older population like preteen would be Mega Everest Prep. The rest of those schools are elementary schools.
Okay.
There are other high schools closer to what is that, Classen Avenue. You have Clara Barton High School, and then there are two schools, I believe, located in what used to be Prospect Heights. So I can definitely give you the contact information if you want to reach out directly to the board office tomorrow.
Yes, please. Yeah. Would that be me contacting? Yeah. Okay.
Yeah. You can shoot over an email if you like after the meeting concludes to BK09-1
Okay.
at cb.nyc.gov.
Okay. BK09-1 at cb.nyc.gov.
Correct.
Perfect. Thank you.
Sure.
Thank you so much. Thank you. Any more questions? Any more comments on the? Okay, thank you so much, Hilaris. As I said, I have your information. So because one time we had someone, I think 2 or 3 years ago, someone came. They did a presentation at the hospital. It's been a while, so I'll be happy to have you to come in to do a presentation as well. That's wonderful. Okay, so Thank you. So as we move on, you can stay and listen, and if you're in the neighborhood, and we meet the first Thursday of every month, and you're welcome to join the meeting. The meeting is open to everyone. So you can join us anytime that you wish to. Just look on the website and the information is there, the login and everything is there, and then you can join us. And for the rest of you, you can also invite your friends, community members, persons who know who are interested, especially when it comes to health, and you can come in and participate. And I always welcome new ideas. So last year we did during COVID, we did healthy cooking in COVID. So we had a doctor who would come in who came online, did a presentation on diabetes, and then we had a young lady who cooked right on the spot online and showed persons how to do salmon and then some other vegetables dishes. And persons were very happy. And then
That was nice.
yeah, and people were very happy. So we were looking, I guess we'll be going back out in-person meeting, but then nevertheless, she can still come to the location. I'm still looking for us to do healthy cooking because COVID isn't going anywhere. And then we have COVID, then we have monkeypox. Next thing we're gonna have foxpox. We're gonna have chicken pox. We're gonna have some other pox coming. So we have to keep ourselves healthy. We have to keep our immune system healthy. So I'm looking to have different persons coming doing different health segments per month. So sometimes we may have a meeting where we are discussing, but as we are planning for the quarter, so we don't necessarily have to have an hour meeting for the quarter. We'll meet, we'll discuss, and then we'll have a presentation, a health presentation. We'll put it out there early enough, send out the flyer early enough so persons who are interested, they do come. And one thing I find with our community is that they don't understand when they say precaution is better than cure. They're getting information and they would not show up for the information, but when something do happen, then they're running and they expect you to come up with some big miracle, which we are not miracle workers, But nevertheless, I tell people, if we are doing something, if 5 persons come, then 5 persons will get the information, and that 5 will multiply by 10 because they will go out there and they'll tell somebody else. So I used to be concerned about numbers, but I get to that place where those who are supposed to be there, then they're the ones who are concerned and they want to better their lives. So as we look at the planning for the quarter, what I will do, the first thing I want to ask, I'm not going to call names, I'll just ask for 2 volunteers. The meetings have been recorded for every meeting. I would like 2 persons. I would like a secretary for the committee and somebody to assist as well. So if the person who is the secretary is not available, then there is an assistant secretary, or both of them could work together. You don't have to take notes. If you wish to take notes, you can go ahead to take your notes. But since the meetings have been recorded, Mia or whoever in the office will send a recording to you, and then you can just pick out the main points of the meeting and then put the minutes together, just format it together, and then you send the minutes to Mia at least 3 days after the meeting. Because Mia then have to put those minutes together and put them on the website, so the board at large and the community at large will go on the board. So those persons who wants to know what's happening in the health committee, then they have an idea as to what the topics were about, what we are doing. So I'm just asking for 2 volunteers. Give me a minute, please. I'm just asking for 2 volunteers. That if 1 person that Mia can send the recording to after the minutes, after the meeting, and then that person will just listen to the recording, pull out the main points, whatever you think that needs to be in the meeting, in the minutes, and then in your absence, then there is somebody else who will, because it's very important when it comes to the minutes. So hold on a minute. I cannot speak and take and do it at the same time. So I'm just looking for 2 volunteers. Go ahead, Mr. Milford.
The minutes that are recorded that we get in print, are we identified by name as to what we said? Or does the person, I mean, is the name of the speaker highlighted in the minutes that we get the recording from? You know what I'm asking? I mean,
Yeah, I can answer that, Mr. Pruitt. The minutes that are turned in provided to the public are not verbatim minutes. They are actionable items and committee voting items. So it's not a verbatim recording of the meeting.
All right, okay.
Okay.
All right. Well, then I wouldn't mind volunteering for that.
To do the minutes?
Yeah, I wouldn't mind volunteering for that.
Okay, thank you much. So can I have someone who will assist in the event that Mr. Milford is not available? That the minutes could go to you, and then you can just Kayla?
Yes, I can do it.
Okay, thank you much. So Mayor, can you make a note of that as well, please? Mr. Milford.
You need him within 3 days of the meeting.
72 hours, yeah. And Kayla. Also, what I will do also, I would like to have like a group chat or something, so we can, I don't want us to wait until the meeting dates, then we could see, and if there is something that we need to talk about, something come up or something, some action item that we need to, that we can have a place where we can text and say, okay, this is happening, let's do this, or because usually what happens is that we wait until the meeting date, that's when everybody meets, and then that's when we talk. So I would like us to have a little bit more action, a little bit a platform where we could communicate, more, and then we could text and said, okay, well, let's do this. I saw this. I went this place, and this is happening, and I think we should do this, or we should do that. Whatever that it is pertaining to the community and what the committee should do at large. And as I said, that I want each person to bring something to the table, and it's not about me, it's about us and the community. I'm looking at as I said, planning for the quarters. We are looking at the nursing homes, and we are looking at the shelters, outreach as well. There are I don't know as to how many shelters. I know of a few in the community. So if you know of any shelters, please let me know so that we could reach out to them. There are family shelters, there are men's shelters, and women's shelters as well. I'm not sure if there are any young people shelters as children's shelters or children homes or anything. I'm not sure if there are any, but if you do know, please let me know. And then for the nursing homes, I would like us, so there might be a certain area that you may be interested in working with. Fine. If you like to go to the shelters or the nursing home or whatever, there are, I don't know, I have to look to see as to how many of us is in the committee, but we could break out into subcommittees and to do work. I'm looking for us also to do some fundraising, because the reason I'm saying fundraising, however, where we can bring in some monies, somebody bring it to the floor. I'm looking for us to do something for the seniors in the community. I was really looking forward for us to have a spa day for the seniors and look for a nice area where we could have the seniors come in and have persons to come in, podiatrists come in and do their toes, and the men get the haircuts, whatever that, to pamper them, just pamper them, pampering for the seniors. I was looking to do that. So this is still on the table because we didn't get to do that. COVID just squash everything. But we have seniors. So the senior homes that I've been working with is Christopher Bledman, which is on East New York. Then we have Shalom, I think, or Shalom is on Albany. Then we have St. Gabriel's and Fenimore. Ebbetsfield have always been under our radar, but we have never really worked with Ebbetsfield. But I know now we had a representative who came in earlier this year before we went on break, and she's willing to work with us to be part of the team. So Ebbetsfield will be one of the senior homes that we are looking to work with as well. As we work with them, we know most of the time, a lot of the senior homes, they get food and stuff from the city, but I'm looking for us to go a little further to get, you know, during the holidays or whatever comes, to get little care packages for them. We can get masks, we can get hand sanitizers and different things that we can get to drop off at the homes and find out as to how many residents they have. Some of them stays right there upstairs. Some have the homes and they go. Fenimore, it's different. Fenimore is right there on Rogers and Fenimore, and they don't fall under the Department of Aging because of the way that the nursing home, the organization was formed. So they get discretionary funding from the from Borough Hall as well as the council members. So years past, they had a lot of issues, and they have persons who are going, seniors going there. They do have persons who go in there, do exercising and yoga and do different stuff with them. But when it comes to funding, it was very, very limited. So we are I still have to reach out to them to see what's happening with them, and we will see how best we can help them. So I'm going to keep quiet and listen and hear what anybody have to say. Any comments, any ideas before we, since this is our first meeting, I don't want to keep you past 8 o'clock or 10 past 8, at least the latest we can end at least 8 to 5. So any comments, any ideas that you have?
Well, I have one. It's a case of one's selfishness playing off, maybe being of benefit to the neighborhood in general, and I make reference to the fact that, as you noticed, as I demonstrated this morning, I mean, at the beginning of the meeting, I have Parkinson's. I was diagnosed with it about 2 years ago, and I'm aware of the number of places and public transportation and public venues that are not handicap access, which I thought was against the law. Maybe now I hear that there's a grandfather element where if you were a business that was in business before they passed that law in the last days of the Bloomberg administration, that you don't have to modify your front. But there's a number of new restaurants along Flatbush and Rogers, Nostrand, where I don't think they go back as far as Bloomberg, and yet they're not handicap access. At the same time, we have the Q train at Prospect Park, where the elevator is frequently disabled. And now I'm fortunate in the sense that it's new. This disease is new, and I'm able to walk with a cane, and I have a walker. But it's still one of the problems with Parkinson's is that your ability to elevate and lift off of your legs is tough. And so what I propose to do, with the board's blessing, of course, is I wanted to get a census of storefronts and public accessible businesses and subway stops that it would be totally unscientific and totally of my own, and it would be good exercise for me to go around and take some pictures of notable businesses that seem to be apparently against the handicap access law. And then from that, we could explore with the city what can happen, what the owners of these properties should be. And ironically, there's a bus stop on Nostrand and Sterling that that is egregious. I mean, this is an MTA property, and it is tough negotiating that that platform. I mean, I find it tough. And that's something else that I would like to examine, would be just what the role the MTA plays in this. So given the number of elderly, and I turned 70 this year, I guess that's my cohort. I would out of selfish reasons, I want to maybe do some good for the entire community and figure out how widespread this law should be enforced. Do you understand what I'm saying?
Yeah, I do. I do. And I applaud you. Thank you so much. Thank you for wanting to take on this endeavor. And you are so right. Even I live right in Lefferts, so this is my bus stop. And I notice it, sometimes because I fell a few years ago twice and I hurt my back. So I have slip disc, and sometimes, especially in the cold, when it adds up, and then you have to raise your legs and you raise your foot, and then on certain angles, it is very difficult to navigate to the bus, to get to the bus. And even some of the train stations, there are some train stations that they are able to accommodate for persons with disabilities, and some don't. So you are very right, and it is something that we have to look into. And we have the transportation committee, and there is a chair for transportation committee, and it is something that we could, even after you do your survey, that you can bring it to the transportation committee, and they in turn will look into it and bring in somebody who then would give us do a presentation, and let them know what our the concerns are in the community for persons with disability. It's now 8:03. Anyone else? I think, Kayla, you did unmute yourself before, yeah.
I just want to say that I really like you guys' focus on senior citizens. I think, and one, congrats, Mr. Pruitt, on turning 70. Go you. But I think we actually talked in one of my classes in high school. I remember about how it's kind of a very American thing for people to not value older people, because we're so obsessed with profits and stuff. So when we think that people are less profitable to us, we care less. But I was thinking, as you guys were speaking, as the program I do with my friends is called Rose from Concrete. As we're moving into more and more schools, I think it could be cool to also be enlisting young people to be doing work when we talk about this spa day or whatever it is that they could be doing. I think it could, one, be helpful to just start to change the values in our community, right? Because we're all going to be there at some point, inshallah. And so letting them know from younger that they should be investing in that. So I think perhaps that could be something that I talked to my organization about us supporting these initiatives. But also I know there's a youth services committee too. So maybe they could be enlisted to work with us on these tasks as well.
Wonderful. Great. Anyone else have any comments, any ideas before we? I'm seeing smiles and puzzled faces, and I know Rihanna, you was unmuting yourself. Go ahead.
No, I was just want to echo what Kayla, that's your name, Kayla was saying in terms of the work in the community, especially with seniors. Like senior mental health is a big deal. I know the city is putting money from the department in terms of focus on mental health, and with the backdrop of the pandemic, we were still somewhere in the middle there. So I'm really excited about that. I'm excited about the spa day for seniors. We did something similar back in my country with an organization that I work with. And for the organization that I volunteer at the Rotary, we actually do work with seniors also in terms of delivering meals. We work with senior organizations that provide services, not only mental health, but other social services to seniors. And we would, we get Rotarians to, come in and volunteer at a time, like whether it's to deliver meals or deliver quilts or hand out PPEs. And we actually, our club provided breakfast for, I think it was Kings County ER workers during the pandemic. We raised about $5,000 and we were able to do breakfast because of course we know during the pandemic was all that stuff. So I'm really excited, one as a community member, but also ways in which I can, if you need support in terms of just getting hands and, just there's
Right.
there's other civil society organizations that, you can always reach out to.
Yeah, as just before the next person, I don't know if there's someone else who wants to speak before, but as you was talking, it just came to my mind is that we may not be able to we could start with the senior centers because we don't have a big enough place to have all the seniors come in, but we have the shelters, we can the senior homes, we could start with them. We can go to each senior home and do a spa day at the senior home, and then we can branch out and find if other locations where we can go and do because we can't do everybody at the same time. But then we can do that because I'm for my block, I have 2 blocks. I'm the president for the block association. So my block is from Rogers to Washington. And what I was planning to take my seniors for a Broadway show and then afterwards take them out to a dinner. So I'm all into seniors and, want to do stuff for the seniors because I think that they always get the end of the stick or the back end of the stick, as one person said, they are always the last persons that we think of. So there are much needed services and there are lots of services that they are not aware that it is there for them. And even during COVID, a lot of the senior centers were shut down. Department of Aging took over and they were sending food, they were delivering the food. And some of them, because of diabetes or whatever health issues that they had, they could not eat the food that they were sending. Some of them, they don't use frozen food, so we were not certain as to what those seniors were getting. And some of them, days they were past, they couldn't get the medication because of COVID, they could not get downstairs, and when the medication was delivered to them, the doorman would not allow the persons to go in to deliver the medication to them. So there's a lot of different areas that we have. We don't know what's coming next, but if anything will come next, we still have to help them find ways to help them. If anyone, I know, Karima, you want to say something? We're gonna cut off at 8:10. Anyone else want to say anything? Karima, go ahead.
I was gonna say about the spa day, that for the seniors, that I know this is something you always wanted to do for the longest time, and COVID kind of messed up everything for 90% of people. I was thinking that maybe we should also reach out to the different health insurances, like Emblem, Affinity, Fidelis, that they have a department or should have a department that involved in community affairs that also deal with like the beauty and makeup aspect, like massages and spa day stuff. I know Health First did it when I was with my previous job place, that they did do it, that they did bring their people from Health First, that they had a massage therapist and other stuff there.
Yeah, definitely. Even when it comes to, as I spoke about the podiatrists, because If we are doing nail clipping, we want someone from the health field who knows what they're doing. Because if
Right.
someone has diabetic, you want them to know as to how
Of
they can
course.
clip the nails and everything. So we have to be careful with the services that we are bringing to them. But it's 8:10. I will stop there because we can go on. I can go on all night because I get
Right.
excited. You know, so I am just so happy to have this team. I am excited. I know we will be doing great things. As I said, your ideas, bring it to the table. I will send out, I know everybody have a WhatsApp account, so I'm going to open a WhatsApp and it's gonna be CB9 HSS. So you'll know that it's from me, so everybody's name will be there, and then we will communicate. And if anything that you want us to do, just throw it in there and let us make it happen. Welcome to each and every one of you again. I am just looking forward to the work that we will be doing.
Last question.
Mhm.
Last question. As it relates to dogs defecating on the sidewalk, is that our committee or the environmental committee?
Yeah, it's not our it's not for us. We don't, but it is something that environmental. Where's Mia? Mia is environmental, right?
Sanitation.
Which or sanitation? Which of the committees looks at that?
It's actually a mashup of both of them. If you have a specific complaint, Mr. Pure, you do not have to wait for a committee meeting to occur for you to do so. You can just reach out to the district office. Dante and I are there every day, 9 to 5. So feel free to reach out if you have a specific complaint that we can help you with.
All right.
Or if you have a targeted location you want us to bring to sanitation's attention.
Okay, all right, I'll do that.
Okay.
Okay, so thank you, Luis, for being with us, for staying on with us. As I said, you're welcome to join us anytime. And for our community members, for our board members, for the members, you are here, we are family. Consider yourself, we are family, and we are taking the bull by the horn and we are riding it. So thank you again for being here, looking forward. And Rihanna, I was in Guyana, and in July, I went on a mission trip. I went to Agricola. So I stayed in Providence, but then our project was in Agricola. This is the second time that I went there. So I came back looking young because I drank so much coconut water and I ate so much sugar cane. So.
You saved some for me?
No, I'm not. I was not sharing. So Alexandra, thank you. Thank you for joining us. And I do hope, where's Alexandra? I'm not seeing her face again. I do hope that you enjoyed the meeting. You could unmute yourself. I hope that you enjoyed the meeting, and then you will visit us again. And we will see you next month.
I did.
And you will be part of the committee. You don't have to be a member of the board to be part of the committee. You could join the committee.
Okay, so how do I join the community?
Mia?
Committee.
Sorry, I'm Amita. You have to contact the board office. You can give us a call in the morning. We'll be there at 9 a.m. and I can speak with you and send you the Google form via email.
Sure, thank you.
Do you have the number, Alexandra, for the board?
No, I don't. I just went on to the community events in the community, and that's where I saw the information.
Okay, you can take it down very quickly. It's 718.
Okay, let me just get that.
Sure.
718.
778.
778.
9279.
9279.
Yes.
Community board 9, yes?
Yes.
Okay.
Okay.
Okay,
So thanks again for each one of you for joining. Thanks for your participation, and I'm looking forward to seeing you next month. Stay safe, stay healthy, take care of yourself, take care of your loved ones, but remember, self-care is important. So take care of you, yourself, take care of your family, take care of your friend, but take care of yourself most
Yes.
of all.
Thank
All
Thank
you.
you. Good night, everyone.
Good night.
right, good night,
night.
everyone. Have a
Night,
wonderful
everyone.
weekend.
Thank
Kamaya,
you.
please don't let the police arrest you on the pathway. I see you doing all this
Oh, no, no, no.
gyrating and everything.
I learned over the years before the shooting and stuff started to get out.
Oh, wow.
Yeah.
Hi, everyone. Nice to meet
Good
you.
night, everyone. Take care.
Have a good
Minor,
Go
Minor,
Serena.
I will liaison with you for the meeting today. So if you have my number, right?
I believe, I'm not sure, but I'm in the
Um,
emails.
Okay, so give me a call. So we will talk person in the meeting today.
Okay, thank you.
All right. So it was well we discussed it, and then is my number in the email? Have a
I'm not
pen?
sure.
You have a pen?
Give me one moment. I can put it in my phone now.
Okay, 917.
Wait, are we still recording? You don't want your.
Hold on one
Oh,
second.
sorry.